Hello Year 9, welcome to this homework video. We're going to look at how has the government prevented disease since 1900. We'll cover mass immunisations, legislation, lifestyle campaigns, and we're going to do activities 2.9 and 2.10. So if you don't already have your workbook, then pause the video, go and fetch it, and when you're ready, hit play. Okay, so we're coming to the end of Inquiry 1 in our workbook on how treatments and preventions have changed since 1900, and our last step is to look at government actions to prevent disease. So first up, you need to find your knowledge organiser and spend a moment just ticking off or highlighting the key dates and key preventions that we're going to talk about in this lesson. Pause the video now to do that, and when you're done, hit play. Okay, so we're going to talk about the government and public health today. Before we start to do that, let's recap what we know and look at the big picture. So we're going to remind ourselves of what the government has done to improve public health in the 19th century and in the 20th century. First of all, we know that in the early part of the 19th century, from 1800 to about 1860, there was a strong laissez-faire attitude in Britain. This was the idea that government should not interfere in people's lives and should not try to keep people healthy. It was up to them to do that for themselves. And so there was very limited government action here. And when the government did try to improve public health, it was quite ineffective. However, that changed in the later half of the 19th century, so between about 1860 and 1900, and the government began to take more action. There were three main things that made the government step in. First of all, Snow's discovery about cholera, that it was waterborne. Secondly, Pasteur's germ theory, which proved that microbes were the cause of disease. And there were some changes to the voting laws in Britain. After 1867, working class men were able to vote, and so politicians had to start listening to them and improving the conditions in towns. This led the government to introduce some really effective legislation on sanitation. That means the government made some really good laws on how to improve water supplies and sewers. And the most important law was the Public Health Act of 1875. This law was really important because it forced councils across England to actually provide clean water supplies and sewers, and that really helped public health to improve. Now, this act, this law, was so successful that it showed that the government can really make a big difference to public health. And that encouraged the government to do more in other areas. So in the 20th century, from 1900 onwards, the government began to take all sorts of action to keep people healthy in other ways too, not just clean towns and clean water, but trying to improve people's health in other ways as well. Now, the main four ways that the government tried to improve people's health are as follows. First of all, they tried to improve access to healthcare and make sure that everybody had the opportunity to get medical care. And we looked at that when we looked at the NHS. But the government also introduced more laws called legislation. The government organised mass immunisation campaigns so that people could be vaccinated. And lastly, the government also organised and paid for lifestyle campaigns to encourage people to live a more healthy lifestyle. And it's these last three, legislation, mass immunisation and lifestyle campaigns, that we are really going to look at in this lesson. So the first thing that you need to do is read about some of those. So you need to find information 2.8 in your workbook. You're going to read that and you're going to use that to do a little task. Here's the task you're going to do. You're going to do a quiz. So you have two quizzes here in task 2.9. Quiz A, you need to do this quiz using the information in information 2.8 to help you. And when you've done that, you need to turn your workbook around and you have a go at quiz B without using your notes. And this is one good way of improving your memory. So you need to pause there and do that job. And when you're done, hit play and we'll move forward. Okay, so the final part of your homework is probably the most important. You need to have some very specific examples that you can use to write about if you are questioned on this in an exam. So you need some examples of mass immunisation. So you're going to find me some examples of diseases that the British public have been immunised against. You also need some examples of legislation. So you need to find me what laws have been made to keep the public healthy. And lastly, you need to find some information on health campaigns. Here, I want to know what campaigns have informed and educated the public about health. And you need to include just 2 reasons for their success. Here's my example, Stoptober, to persuade people to quit smoking. And that really was successful because it was advertised online and TV, and it gave people helpful advice on how to quit. So it really worked. This is your last task today. When you're done, your homework is complete. Well done, Year 9, and I look forward to teaching you next lesson.